timid about coming to get this vaccination.
While many can't wait to get vaccinated, there are still some people who don't want the shot. Hi, everyone, and thanks for joining us tonight at 11. I'm Erin Connolly.
And I'm Mark ZINNI. Now, that hesitation by some was actually highlighted during an event tonight in Bristol. Channel 3 Eyewitness News reporter Matthew Campbell is live right now in the newsroom. Matthew has more details. What happened here?
Well, Mark and Erin, all week we've been hearing stories of people struggling to make appointments and going to great lengths to get their dose. But tonight, we saw the opposite. Bristol Health made getting a vaccination appointment as easy as coming to the HRA building on South Street and seeing a volunteer face to face.
Our mission is really to get as many eligible recipients an appointment as soon as possible so we get them vaccinated as early as possible.
The hospital partnered with Bristol's NAACP for this potentially life-saving event, hoping to reach a community that is experiencing vaccine hesitancy.
There's still some people who have some reservations about all the rumors and the things that you hear.
Former WFSB sports anchor Eric CLEMONS is the president.
The medical community, I think, has our best interests at heart. Let's trust the medical data here.
Apparently, that trust still needs to be earned by many because over the span of 2 hours, officials estimate 25 people showed up. During our hour there, we found Lorenzo Brown Sr. He was booked for a late March appointment in less than 2 minutes.
I think everybody else should go and get the shot too, so I recommend it.
You can see the racial disparity in the latest numbers from the state. Nearly 7% of the black and brown population have the first dose. 16% of whites got it. Community officials are working tirelessly to get the message out. The efforts come on the week that Johnson & Johnson doses arrive in Connecticut. These are one-dose shots, making it a more attractive selling point for those who are trying to convince their community to stay safe.
We're going to be looking at that doing mobile clinics, and it's going to be a lot easier to navigate and logistically support the Johnson & Johnson.
The Johnson & Johnson efficacy rate is lower than the Pfizer and Moderna shots, but Dr. Carl Mingus explains J&J was tested when other COVID variants were already out there.
The number of ways in different types of variants that the J&J vaccine has encountered and has included within the clinical trial data is much more in extent than in the single strain that really there were no mutations with the Pfizer and the Moderna trials.
And we've heard it from Dr. Mingus to Dr. Fauci. They say bottom line, it doesn't matter which vaccine you get. The low turnout at the Bristol Health event tonight will not stop them from putting on more. Officials say there are plans for mobile vaccinations and mobile scheduling. Live here in the newsroom, Matthew Campbell, Channel 30 News.